it was less fearful, more positive for me to do that. And that is exactly what I did, and I set on a course to heal myself, which I did.
Okay, very good. That's fantastic. Now, you said that at the age 22 you were able to, you said that at the age 22 you were able to, figure out how to cure yourself. Age 22 is a very young age, especially when you go and see a doctor and tell the doctor that you have this problem, and then they say, well, you have a uterine tumor on your uterus on top of it. And if I were a 22-year-old a man or a woman, doesn't matter, if somebody tells me I got a tumor in any part of my body, first thing that comes to my mind is fear. And then the second thing is I will subject myself to whatever the doctor says, because I am afraid that I am not no more experienced or trained than a doctor, and then I will submit myself. Now you are saying that even if the doctor comes and tells you, listen, you are going to die in 6 months, if I don't give you radiation, surgery, and chemotherapy, you are saying that, well, I have to really think about this. Now that's a very brave woman. So what is your advice for?
He didn't say those things to me. He just said that surgery would be recommended.
You see, now
Yeah,
oh, okay, now
yeah.
let me
So
come.
so he said surgery would be recommended. I didn't even know. This. I'm 66 years old at that time. I mean, I didn't know what chemotherapy or cancer was or anything. I had no background, but I followed my gut, and that's what most people don't do today. They sink themselves into a fearful place, and they don't follow their instinct. And so I just, for the first time in my life, made a really correct decision and cured myself of this um, issue from taking responsibility for it, understanding everything that I experienced in my childhood, and knowing that there has to be another way.
That's very interesting, because lately we had a series of guest experts who are experts on alternative medicine, holistic medicine, and so on and so forth. We had a couple of weeks back a gentleman called Helvey, and he had the same situation. He was found a tumor on his lungs. Now, of course, in his case, so I thought that's the same, pretty much the same, but it's not. In his case, his doctor told him that he gave him 6 months to live unless he subjects himself to chemotherapy. Carl said that no, I'm not going to do it. So he went back home, and he had another brother who went through chemotherapy and died 6 months later. So he said, I'm not going to go through with this. So I'm going to go ahead and treat it holistically. And 37 years later, he came on the show and he said that I'm still alive and there is no trace of lung cancer at all. And there was another lady that came yesterday. Her name is Belinda Farrell, and she is into the Huna medicine, the Hawaiian naturopathy. And she said that she had serious problems in her life. There was a tumor on her thyroid, and she said the same thing. She went through, of course, not everybody went through homeopathy or Ayurveda or holistic medicine. They went through each one their own path, but none of them had much faith with respect to themselves on getting this treated by the allopathic medicine. Now, they also said clearly that there is a place for allopathic medicine in terms of a bone fracture or something else. So what is your opinion now? Do we have any place in our lives for the modern medicine?
Can you repeat the question, please?
Well, the question is, do you think that the modern medicine, the allopathic medicine, the medicine that the doctors now practice in most of the hospitals and everywhere else, does it have any role to play, or we have to be very careful and ask the right questions and make our own decisions, when especially if the condition is somewhat more serious and you have a feeling that the allopathic medicine will not be able to treat it?
Well, that is up to each individual to make their own decision.
Okay.
And as a health provider for 30 years, I think that alternative methods work if you have a mind, body, spirit approach. And I think some of the best way people to do this are in other countries where they don't have the laws that we do, where doctors could lose their license for recommending homeopathy and recommending natural medicine. So I think that in the United States, in my opinion, it's very difficult to get the full spectrum of care that a cancer patient needs from a licensed medical doctor. And other countries don't have those same rules. And I think that someone who has a serious health issue and has been diagnosed with cancer needs to get a few opinions. And then my opinion would be, this is just my opinion, and my opinion would be to disconnect from allopathic medicine completely and to find a very experienced health provider who can help, work with a person to reverse the process using detoxification methods, using mind, body, spirit, acupuncture, meridian work, that can do emotional work, that can do nutritional work, homeopathic work, herbal detox work, all of it. All of it is good, all natural things, but just picking one natural thing of only doing, let's say, homeopathy. Homeopathy is the best form of medicine that has ever been invented, in my opinion, and it can do anything. But while you're doing it, you can also do an herbal. You can also do an herbal.
Okay. Sorry, I'm sorry. Go ahead. Hello?
Wow, that was really loud. Yes, that was
I don't
really
know
loud.
where that came from. You heard some music?
Yes.
Oh, okay, all right.
Okay. So anyway, I completed my thought there.
Oh, okay, very good. So now one thing that I know, that when you have a growing uterine tumor on the uterus or on the lungs, it's usually they don't just simply go away. They usually continue to grow in size, and eventually they could become cancerous. Or most of the time they do, unless it's not, unless there is an early intervention. In your case, you said that you were able to reducing the reducing the size, and eventually it disappeared. In your case,
Well, it went away in 6 months because I changed my diet and I went into a health food store, and for the first time, I went into the health food store and I found a book by Pavo Arola called How to Get Well, and he had a protocol for treating tumors,
okay.
and I followed it. I followed it to a T, and I felt very positive. See, a lot of healing has to do with your mind. Negativity will create disease, and if your mind goes to the negative about things, and even if you're a health provider and you scare your patients into a negative, thinking, then you are actually hurting your patients. And so the whole idea is um, to inspire people, to give them hope, and to give and guide them towards natural medicine.
Very good. One of the things that always a concern to those who are not familiar with alternative medicine is, when the regular pharmaceutical companies, when they go ahead and do their testing, there is usually a large number of patients, and they also have, very well that they have a crossover double-blind trial or one of those types where they are going to exactly prove that their product is superior to an existing product, or a placebo tablet or capsule. Okay. Now, when it comes to alternative medicine or holistic medicine, or in your case, the homeopathy and natural medicine, uh, the FDA is not. I don't know whether are they in control of any of this, or they don't control any of it.
FDA controls homeopathy loosely. They grandfathered it in as when they became company or part of the government. The first thing they did was they grandfathered in homeopathy because it's so much research that it can't be denied. It's 200 years of research, and There are homeopathic hospitals now in England and all over the world. Homeopathy is one of the leading sources that health providers and people turn to for healing. It is very effective if you pick the right remedy to use. It is very effective, and
What is
people
the
love it.
what is the role of homeopathy in U.S. Medicine, in the U.S. medical practice?
Well, lots of health providers in the United States more and more are using homeopathy. More and more medical doctors are being exposed to and using homeopathy, maybe even not telling anyone that they're using homeopathy.
Uh-huh.
But because sometimes they get threatened that if they do too many things outside the mainstream, that they can lose their license. So, the problem is really the training in the United States for medical doctors. That is the problem. And but FDA does not control supplements, does not control herbs, but they do control homeopathy, and they loosely control it. Albeit in the last 5 years, they've stepped up a little bit more control of it because it works so well. But I mean, they can only control it to a point because of the research. There's no side effects, and it really works if you pick the right remedy for according to your symptoms.
Okay. Now I know that lately they are also controlling, natural medicine, or some of those herbs and nutritional supplements, because I know from for a fact that if you come up with a new dietary ingredient, a new nutritional supplement that is not previously been used, or if it is not grandfathered, then you have to apply for an application with the FDA, and you have to provide toxicity data, and it is a very expensive proposition nowadays. You might have noticed lately there is no new nutritional ingredient being approved at all. You cannot bring in anything new, even as a nutritional supplement. Pretty much that area is pretty much blocked off. And if somebody is selling it, they probably don't know the regulations. Eventually they will probably get caught on this. With the homeopathy, I remember that there were homeopathic medical colleges all over US. How many are still there, and how many are actually producing homeopathic doctors?
In the United States, there's the British Institute of Homeopathy. I founded the California College of Natural Medicine, and we have homeopathic medical practitioner training. And I am not sure about other institutes or other colleges that offer a homeopathic medical doctor degree in the United States, because in most states there's no licensure necessary for homeopathic medicine. But in the world, I mean, there's homeopathic curriculum available at universities in other countries. Yes,
Okay.
other countries are much more advanced in using and homeopathy, and the many clinics that use homeopathy. Where I studied in Germany, my goodness, I mean, you could go on a street and go to a pharmacy, and half the pharmacy says on the window it's homeopathy, and the other half is allopathic medicine. So
Right.
I mean,
Well,
you,
doctor, just a minute.
you know, it
We have to take a break here. We have finished our first quarter. The conversation is just heating up. It's very fascinating. I'm just starting to wonder why there are no homeopathic medicine the way it is practiced all over the world, except here in the U.S. We will explore that, and then we will come back and talk about a number of issues that I wanted to ask you. For example, the what you know the neuro emotional remedies, protection from radiation, freedom, detoxification diet, and also one of my concern is on hormone replacement therapy. Ladies and gentlemen, you are listening to Dallas Live. I am your host, Dr. RC. The number to call is 469-307-1642. You are also listening to Dr. Theresa Dale. We will be right back in a few minutes. And Dr. Dale, please stay on the line. Yes, ladies and gentlemen, welcome back to Dallas Live. I am your host, Dr. RC. You are listening to Dr. Theresa Dale. She is an expert on natural medicine and homeopathic hormone rejuvenation therapy. Dr. Dale, welcome back to our second segment.
Thank you very much. It's wonderful to be back.
All right, let's go back and one thing that I noticed, the FDA in the U.S. seems to be trying to protect ourselves from ourselves. So they are thinking that they have to control everything, and they also, I believe, I as a radio host, I have some liberty to probably talk about this. That I noticed that many of the medicine, alternative medicines, holistic medicine, or other types of medicine, homeopathy and etc. They are actually, even though they are saying that they are loosely controlling it, they may be loosely controlling the products, but they are very tightly controlling the practitioners. And especially if you are a medical practitioner, as you said, you are not even allowed to talk too much about it, and be careful whether you are going to prescribe and tell your patient, yeah, go ahead and take care of yourself using holistic medicine or alternative medicine or homeopathy or whatever else. Why is such a restriction placed on doctors? And once you answer this, then we will go to some of your other points.
Well, I want to put a lot of positive attention on the system changing in the future, and that traditional medicine training changes. I want to see it change so that really good people, medical doctors, don't lose their license for doing the right thing. And that's where we are right now. Where we are right now is, people sometimes have lost health providers, licensed doctors who are really excellent in natural medicine have lost their license. And I always tell them, give it up, let it go. Do natural medicine. You know what I'm saying?
Right.
And so I feel that you just need to be real positive and not, doctors have an opportunity to change. and they have an opportunity to grow. They can make new choices. They don't have to use allopathic medicine. Um, so I feel very important. It's very important if there are any medical doctors listening that we need to to say, okay, we empower you to make the change. And I've trained health providers who were medical doctors and even surgeons who quit their job and now do natural medicine. I mean, people do it all the time because they get tired of not having an answer, where the answer is cut it out or drugs. Okay? This is not the best answer. This could be an answer for some people that works for a while. You know what I'm saying?
Yes.
But the whole attitude and the whole energy around around with allopathic medicine is based on controlling the patient with fear. And I totally disagree with that model because it makes the immune system lowered. It lowers the immune system. So when you're talking to me, you're getting my opinion, and my opinion is that allopathic medicine is very bad. And except if you're in an accident or you need emergency care, we're the best in the world at emergency care, okay?
Right.
But that is to make a person, live, emergency care. After that, I believe, as in other countries, I believe that they offer people natural medicine if they want to do that in hospitals. And the answer is yes, because they want to get them out of the hospital so it doesn't cost the government too much money, because otherwise they could be in the hospital for a long time. So in some government controlled, in some countries where government runs healthcare, it's actually to the patient's benefit. Okay?
Mm-hmm.
And so, I mean, this is when you travel to other countries, you get to, and you go, observe what they do in hospitals. You go check it out, what people have in hospitals in other countries and in healthcare. You start realizing that the United States is way behind because
Mm-hmm.
of the training of allopathic medicine doctors. So, um, you know, I mean, that's just my belief system from traveling all over the world, from studying in Germany for 9 years, from studying in England and seeing, what other countries have. And I find that when it's when it's up to emergency medical care, we're awesome. The United States is awesome. When it's up to any other kind of medical care, we're not so awesome.
Okay, so looks like the American Medical Association, in cahoots with US FDA, has pretty much given scare tactic to the patients, and they are forced to come in for allopathic medical practices, simply because that's how it's going on here in the US. Now, Dr. Theresa is the dean of the California College of Natural Medicine and president of the Wellness Center for Research and Education. She is the author of the book called Revitalize Your Hormones, and an inventor of new medical models and products. And also, Dr. Dale trains health providers in traditional naturopathy and clinical nutrition and biological medicine. So, in my opinion, Dr. Dale is highly qualified to talk about this is subject matter. Let's talk about hormone replacement in the next few minutes. I went through your website and I read through some of the work you have done. It looks like you are a proponent of hormone rejuvenation therapy rather than hormone replacement therapy. Can you tell our audience the difference between the two and why you want to do the rejuvenation rather than replacement?
Well, that is a good question, because this is, um, hormone replacement, like bioidentical hormones. It's a marketing thing. There is the only hormones that are bioidentical to what you make as a human being is your own. There's nothing that can be replicated in a test tube that your body is going to use as if it were its own hormones. And so one of the reasons why, and everybody listening should be asking, why is that true? And you should be asking questions like crazy, okay? Because we have a circadian rhythm, we have a body clock, we have a rhythm to our body. And that rhythm, it goes along with the different times of the day and night where the body makes different hormones. Okay? Now, as soon as you give hormones from outside of your body that is not made by your body, okay, then that whole body clock, that circadian rhythm, gets skewed. It doesn't work right. The rhythm gets messed up because the body knows that it didn't make those hormones. You're taking those hormones in a pill. You're not making it in your body. It's coming from an outside source into the body. The body has an innate intelligence that knows that. Therefore, the body treats bioidentical hormones or hormones that you buy in the health food store, any hormones. It treats it as something that the body does not make it. Therefore, the body gets confused and starts slowing down production of its own hormones, actually aging the body. So if you want to age your body, take hormones.
Wow,
That's
that's a
the
very
way to.
strong statement. Now, our audience should realize what doctor is saying is that the body has a mechanism, or it is innately aware of a hormone being centered by an oral route versus being produced at the site of production, perhaps adrenaline or thyroid or whatever pituitary or whatever the gland is, and if you are going to send it through mouth, the body knows, hey, it's not coming from pituitary gland sitting right underneath the brain. It's coming through the liver. The liver is not supposed to be producing this, or our liver is not supposed to be supplying this from the to the blood. So I totally understand that the body knows that even if it is a bioidentical hormone, it makes no difference because the route at which it is entering the blood and the amount of this hormone getting in there, and it is not a natural process because if you take it orally, any hormone, some of it will be chewed up by the liver, and whatever is left is going to unload itself in huge amounts into the bloodstream, and that's not how body functions. Whenever there is a need for it, it produces it. Whenever there is no need for it, it shuts itself down, and there is a very good homeostasis or a equilibrium mechanism there, right?
Right. I mean, it's like the body, people think, oh, it's bioidentical. The body's going to like it. No, the body's smarter than that. It knows either you're rubbing it on your body
Right.
or putting it in your mouth, and the liver has to process it. It makes the liver very toxic.
Right.
And how I know this for a fact is I have analyzed over 20,000 before and after salivary tests, not on my patients. It's third party, my doctor's patients. Over 20,000 people, well over. I stopped counting
Oh,
in
okay, hold on.
2000.
Dr. Dale, we are already coming to our next break. Hold that thought. I want to keep our audience under suspense. You did 20,000 saliva test, and I would like to know what is the result of this test when we come back. Ladies and gentlemen, you are listening to Dallas Live. I am your host, Dr. RC. The number to call 469-307-1642, and we will be right back. Dr. Dale, please stay on the line. Ladies and gentlemen, welcome back to Dallas Live. I am your host, Dr. R.C. We are talking to Dr. Theresa Dale. She is the expert on natural medicine, and she's also the Dean of the California College of Natural Medicine. And she is also an expert on homeopathic hormone rejuvenation therapy. Doctor, welcome back to our third segment.
Thank you very much. It's very nice to be with you today.
Very good. And now we were on our break. Before the break, we talked about 20,000 saliva tests. Go ahead and explain to our audience what you found before and after.
Well, in my medical abstract, which is on my website, you can actually see the results. But before I really, I wanted to find out because homeopathy, a lot of times when people take it and they cures health problems, they don't do a blood test before and after. They don't do before and after. So I wanted to make sure that everything I did was researched with testing, blood testing and saliva testing. Blood testing for hormones is not accurate because it doesn't determine it doesn't test the free unbound hormones. All of the hormones and protein and all of the hormones are bound by proteins, and so all the hormones are not available to test in blood. So we started doing saliva testing and found it to be much more accurate, like considerably more accurate. So we started in the year 1999, 2000 to test using saliva testing. And we tested well over 20,000 of them. I stopped counting in 2009, maybe 2009. I stopped. I didn't stop testing. I stopped counting how many people we've done. But we've done well over 20,000 people, and it's very clear, very, very clear that people's hormones get balanced, their symptoms go away or get considerably lessened, and they're doing my homeopathic program on hormone with hormone rejuvenation. So they're doing my NuFem and my EndoPure products to rejuvenate their hormones. And so it balances cortisol levels and all other hormones that are for men and women. So it's very clear to see that we have so much research, more research than any drug company has, because the more research they do, the worse the results are.
That's right.
The more research we do with homeopathy, the better the results are.
All right, now question. Now you said that you switched from the blood testing because the hormones are bound to proteins, so you were, and there was only a small fraction of the hormones were free in blood, so therefore you wanted to test them in saliva. Now, so are we talking about the testing when you do it when they are young, for both men and women in their 20s and 30s, versus men and women in their 50s and 60s? And then you are comparing them, and when do you put them on homeopathic medicine? See, it's not very clear to me.
When you put them on homeopathy after you get the test results, and then I create a custom program for each person.
Ah, okay, good, very good. So I see that part was, yeah. Go ahead, yeah.
Yeah, the custom program is dependent upon the results that we get. So that everything is custom. Even though homeopathy would probably work without a saliva test, I like people to know what their levels are before and what their levels are after, because I want to know and I want them to know. And I think everyone should want to know, and they should also know that blood testing is not accurate. You can't see what you can see in saliva testing. And so many doctors today are using saliva testing, but many of them are being told by they can use any testing they want, but they are trying to stay to the normal way of doing things in using blood testing, but that does not provide accurate information. There is no doubt about that.
I see. The hormone replacement therapy, from what I understand, my limited knowledge, especially for women and especially for women going through menopause, and that's when it appears that their hormones are declining. And the doctors and pharmaceutical companies came up with this idea that they will replace this hormone with artificial, or I believe they also extract this out of the female horse urine, correct? And then I think there is a name for it now. About 5-10 years ago, this was the number one prescribed drug in the entire United States, in billions of dollars. Now, what you are saying is that, well, of course, they scared the women, saying that if you don't take this hormone replacement therapy, the allopathic medicine way, then you are going to get osteoporosis and you are going to die young, and all kinds of other problems will come up. Now, when the women go through this menopause, and during that time period, I would understand. I understand that the hormone levels, the specific hormone levels, are actually coming down in quantity in their bloodstream. Therefore, they have to replace it. Is that the idea from the allopathic point of
Well,
view?
the idea is it has been proven that hormone replacement, from a few different kinds of hormone replacement, which was used in the Women's Initiative study, absolutely causes cancer, strokes, blood clots. Absolutely, they had to stop the study. This was way back in the year 2000, 2002. And so there's no doubt that hormone replacement causes cancer. None. And I've also seen it with people who are on bioidentical hormones who have come to me and say the only hormones I ever took in my life was bioidentical hormones. I was on them for 2 years. I don't have cancer in my family. No one in my family has cancer. And now I have this. And I've been on them for 2 years. I mean, it's really a slam dunk. It's like obvious. And so to even argue the point is ridiculous. Okay? I mean, and men can get testicular cancer too. I mean, it's not just women, it's men that get. You just research on Google cancer rates for men um, using testosterone.
It's
Okay?
pretty high.
So, well, you just research it and you'll
Okay.
see
Okay.
what it is. I mean, it does cause cancer, all hormones, because the body doesn't make them and they are toxic to the body. It will elevate certain hormones and skew, just change and cause out of balances in the body where I mean, I see it every day looking at saliva tests. The only way to know what's going on with your body is to do one on yourself, and then to see what is the results from doing one on yourself. So I tell everybody listening. I don't know how many people listen to your show, but whoever's listening, that they should, male or female, they should do a saliva test to know the truth. I mean, this would be the best way to do it.
Okay, so how
So,
will they do the saliva test? Where do they get the kit or equipment, or how does that work?
well, it's very simple. They just get it on my website,
Uh-huh.
and I've invented a saliva test panel that my clients can do, and that saliva test panel is on the website at naturalhealingpro.com, naturalhealingpro.com, or they can go to the wellnesscenter.net and read more about it there as well. So I would suggest people get their own saliva test. I would also suggest that people become a member of my wellness club so that I can help them. It's a private club which offers them tremendous education about their body and also offers them a discount on saliva testing.
Okay, so
So,
ladies and gentlemen, the website is wellnesscenter.net. One word, wellness center. All right, now I was just looking at your website, and I noticed there is a little talk about five elements saliva testing, and this is the one that they can use your kit to check on five elements. And what are those five elements?
Well, that's a very good question, Doctor. I can tell that you're much more experienced than most people doing a radio show, and I love it. And the five elements that are tested is the fire element, the water element, the earth element, the wood element, and the metal element. Okay, and each element in acupuncture, it's the five element theory of acupuncture, which is one of the oldest systems of medicine ever developed. It's 2,000 years old and it's extremely accurate. And so those elements are all related to organs, glands, emotions, and meridians.
Mm,
Okay,
mm.
and there's a body clock. There's a five element body clock, and you can see that on my website. You can explore that, and then you can decide if you would like to become a member to get a discount on the saliva test. So I suggest knowing the truth about your hormones. I don't I don't like to tell people what to do with their hormones unless they do a test, because there's no way that I can know the body and the numbers. I mean, I need to know numbers like how high is your progesterone or how low is your progesterone?
Mm.
What are your hormone levels for your estrogens? Do you have three estrogens? Okay, what are your levels for uh, testosterone and five cortisol levels? And are they high or low or normal?
I
Also,
see.
you're tested for gliadin, which is gluten intolerance. You're tested for food intolerances. You're tested for candida, and your immune system is tested with this test that is done. So we get a pretty good blueprint of what's going on with the body.
Okay.
So otherwise, in my opinion, is otherwise everything is hearsay about your hormones. And the main thing I think is to also read my book, Revitalize Your Hormones. That'll also direct you to do a saliva test, but it'll give you a diet. It will offer you a diet that balances the body and helps to balance the endocrine system, which is mostly a vegetarian diet, which I eat myself, and I recommend for everybody to eat vegetarian as much as possible.
Very
Um,
interesting. Okay,
I,
doctor, we have to hold your thought right there, because we are coming to a conclusion on this. We need to go on to a commercial break. Ladies and gentlemen, you are listening to Dr. Theresa Dale. She is the Dean of the California College of Natural Medicine. She has also written a book, Revitalize Your Hormones. And we were talking about various aspects of natural medicine. And when we come back, I would like to ask Dr. Dale about the amalgam fillings and your health. Now, there seems to be some controversy, so we are going to clear this up in the next part. Ladies and gentlemen, we will be right back. And Dr. Dale, please stay on the line. Ladies and gentlemen, welcome back to Dallas Live. I am your host, Dr. RC. You are also listening to Dr. Theresa Dale. She is a mind, body, and spirit. She's an expert on approaches using mind, body, and spirit with natural medicine. And I guess I hope I didn't mix it all up. But before before we went on a break, I was going to ask her about amalgam fillings and your health. Now, amalgam, my understanding is that whenever you mix a metal with mercury, and the resulting chemical composition is an amalgam. Now, doctor, what is amalgam filling, and how is that related to our health?
Well, amalgam filling is mercury and other metals that are amalgamated, that are mixed together to create mercury amalgam fillings. Now, to make it seem nice and pretty, it's called silver fillings. Silver fillings have a little bit of silver in it and a whole lot of mercury in it. And so silver fillings are mercury fillings. It's the same thing. And so these mercury fillings are outlawed and not allowed to go into certain countries because it causes cancer and autism and other health issues. And it's been linked to that so much. So that other countries, Sweden, Denmark, Germany, other countries, do not allow it to be used by dentists. So that is the first thing. And we need to know that they're very toxic. You can read about it on my website. And you can also Google toxicity of mercury amalgam fillings and find all kinds of interesting information about the diseases that have been related to toxicity from mercury, which is which goes into every person's mouth unless you tell the dentist not to do it. And you will know if you have them because if you open your mouth and look in the mirror, you'll see that the fillings are dark. They're black. And those are mercury fillings. Porcelain is white. Other types of white material as well are used. And then gold fillings are obviously gold.
So so you are saying that the amalgam fillings, are they still allowed in the U.S.? You said that the other countries have banned them, but apparently the American dentists are using.
They are used regularly in the United States, in children and in adults, and we will hope to have some things at the UN to at least prevent it from being used on children, and so. Things are being done, but people need to be aware. You can't wait for your health provider to tell you these things, or for your dentist to say, I'm not using these, we're mercury free, although there are a lot of mercury free dentists today.
Very interesting. See, I did not know that. Well, I knew that mercury is a very dangerous poison, and they even have rules against tuna fish, how they are captured and how they are being loaded with mercury, because the fish seems to have the ability to accumulate mercury in their tissues, and tuna fish eaters have to be very careful. But what you are saying is even more interesting, because that the dentists are putting it in children's mouth, in their teeth, and apparently FDA is okay with this because they are not controlling or regulating any of it, and it seems that there are so many different problems that the FDA is happily allowing such toxic materials to go into our bodies. But at the same time, when you come up with a good product, a good natural medicine, and a holistic approach, mind, body, and spirit approach, apparently they are not interested in any of those, because it seems, many years ago I talked to a senator. The senator said, I told him, listen, why don't you pass this law or that law against these pharmaceutical companies trying to push all these drugs? He said, listen, you don't understand. We are under their control. The pharmaceutical companies control us. We have no other choice but to pass the laws as per the pharmaceutical companies want us to pass them in the Congress. Therefore, we are helpless. So no matter how much you guys shout, or how many NGOs and other companies come out there and say that you cannot get this done or that done, we are helpless. So our government is all sold out. Coming back to this other problem, I was looking at your website, doctor, and there are so many other things that we need to go into details in one other show.
And
But but one
right.
thing I wanted to talk to you about is the thyroid function, balancing thyroid function without drugs. I know that a large number of people are suffering from this. Tell us, our
I'm
audience,
sorry. I'm sorry. I'm sorry, doctor. I am out of town, and out of time, and I have my next appointment coming into me right now, which is a patient. So I thought the show was going to be for an hour, and I'm just about ready to go on an appointment. So I'm not going to have time to communicate any further. I'm very sorry.
Yeah, no problem. Okay, let's do it some other time. When you come back, we will talk about the rest of your website. And ladies and gentlemen, you are listening to Dr. Theresa Dale. She is a natural medicine and a homeopathic hormone rejuvenation therapy expert. Doctor, thank you for joining us.
Thank you so much. I really loved the show, and I love what you're doing, and thank you. I really appreciate it.
Yes, most welcome. We will get back to you. Ladies and gentlemen, we will be right back.
Thank you.
Welcome.